All right, guys, Dr. Joseph Bogart here, chiropractor in Parkland, Florida. And what we're talking about today are things you can do at home to help you with frozen shoulder. Now, in our office, we incorporate several different things like adjusting of the shoulder girdle, retraining of the muscles, shockwave therapy, classical laser, wave patches to help get that shoulder joint back where it needs to be, breaking up adhesions and stimulating the healing of tissue. But at home, there's a few things you should do. Stay tuned, I'm going to show you what they are. Make a quick video to show you things you can do to help with frozen shoulder adhesive capsulitis. Adhesive capsulitis is when your body produces collagen-like fibers or adhesions to protect your shoulder from some type of a micro or major injury that you sustained, and so it's trying to keep it from moving so the tissue underneath can heal. Let's go through some things that you can do to improve the mobility of that shoulder. First of all, we have 5 ranges that we really want to work on. The first is flexion, abduction, adduction, as well as extension and external rotation. Let's go through them. So for flexion, imagine this is my injured shoulder. I'm going to use a pole, a broomstick, or a PVC pipe, and I want to get my hand up as high as I can to where I can't go any further, and then slowly walk back, which will put the shoulder further into flexion. Do that 10 times and hold it for about 10 seconds in its furthest position where you're starting to feel a little bit of pain, and then relax. 10 seconds and then relax. See if you can go up a little further. Then do 10 more seconds here and do that about 10 times for 10 seconds. That's in flexion. Then you're gonna do the same thing in abduction, which is bringing your shoulder up over your head. So you're gonna try to go as high up as you can, and then walk away. Right there, that's where it hurts. Hold it 10 seconds, come back. See if you can go a little higher, go out. See if you can go a little higher, and before you know it, you're gonna start improving that motion, getting it up higher. 10 seconds, 10 times in various positions. Now you may only get it to go from here to here. That's okay. Next time you do it, you may find you get to go from here to here, and it will gradually improve as you go. So we've done flexion, abduction. Now we have to do extension. Extension, if you have it like you're holding it here, go to where this is as far back as you can go. Start walking forward. That's going to pull it back. If that's where as far as you can go, hold it there for 10 seconds and then relax. 10 seconds and relax. You may want to see if you can go up a little higher, a little further back. 10 seconds, relax. That's extension. Then you have adduction, which is meaning it's pulling it towards your body. So let's say you can't get your arm back further than here. You're going to try to pull it as far as you can, hold it for 10 seconds, relax a little bit. See if you can go a little further, 10 seconds, relax a little bit. Use this hand, your good arm, to pull it through a little bit, and hopefully you can get it far back behind you. That's adduction, or towards your body. And the last is external rotation, which means you're rotating your hand out. Most people have a really hard time with external rotation. So with your elbows in towards your body, you're going to hold a pole like this and slowly bring it out as far as you can go. Hold it there for 10 seconds, relax. A little further perhaps, 10 seconds, relax. 10 times in that direction. So you have flexion, abduction, adduction, rotation, and extension. Those are your 5 motions. Now we're going to talk about PNF stretching, proprioceptive neurofacilitation. Basically, it's reciprocal inhibition. Basically, we are going to stress a certain muscle group to allow the opposite side to relax. So the same things that we just went through in those stretching motions, we're going to do, but with opposite pressure. So for flexion, we're going to walk this up as high as we can go, and I'm going to try to drive this pole with my arm straight down into the ground for 10 seconds, relax. See if I can go a little further. 10 seconds, relax. Go a little further. 10 seconds, relax. If I can't go any further, I'm going to keep working that spot for 10 seconds, relax. 10 seconds, relax, and at the end, see if maybe even I can creep up an inch or two. That's flexion. For abduction, meaning I want my arm to go up, I'm going to do the same thing that I did in flexion, just to the side. Try to bring this up as high as I can. I'm going to drive it down into the ground. You're going to feel the muscles of your lats, you're underneath your shoulder and your scapula. Pulling it down, relax. See if I can go a little further. Pull it down, relax. See if I can go a little further. Pull it down and relax. That's how you're going to do it in abduction. Then we have extension. An extension can be done when you're walking this forward here. I'm going to drive it down forward as far as I can to relax and see if I can get it to go further back. Push it down into the ground. See if I can get it to go further back. Down into the ground. See if I can get it to go further back. That one's going to be very painful for most people, and that's in what's called extension of the shoulder. Then you have adduction, which means I'm trying to pull my affected shoulder this way for this bad shoulder, if that's the case. But I want to pull it as far as I can get it, and then I actually want to pull it outward against resistance of this hand. 10 seconds, relax, see if I can bring it further. 10 seconds, relax, see if I can bring it further. And you can regrip, pulling it this way, but I'm using this as resistance. Pulling it out, 10 seconds, see if I can go further. That can be a little bit confusing, but follow the video a couple more times. And then, of course, last but not least is external rotation. So for external rotation, I'm trying to get this arm this way. So what I want to do is I want to get it to the point where I can't get it much more, and then I want to hold it here with this hand and drive this pole essentially in this direction against resistance. Hold it 10 seconds, see if I can go a little further. 10 seconds this way, see if I can go a little further. And while doing that, make sure your elbows are in towards your body, keeping them tight. That's the PNF stretching routine. Do that sets of 10 at a time. Hold it for 10 seconds to start loosening up with what's called reciprocal inhibition of that shoulder. All right, last thing you want to do, if you have a lacrosse ball, that's probably going to be the best because it's a hard, dense rubber. If you have a tennis ball, a racquetball, or something that's pretty hard and round, that's going to be helpful. What you're going to do is we're going to be working the posterior aspect of your shoulder. So if you put your thumb on this bone here, which is your AC joint, get your finger to wrap around right about here. You're gonna have to play with it. That's about the spot you want it. Do it on the floor or against a wall. You're gonna put this ball in the posterior capsule of your shoulder. You're gonna know because it's gonna be uncomfortable. And while you're here, you wanna literally just try to reach over this way, and you're gonna feel that digging in there. Ooh, that feels good. Well, if you like pain. You're going to do it like this, and then also rotate your arm if you can forward and back like this, and you may even want to sweep the floor with the back of your arm like this while that ball's under there. Do that for about 2 minutes, and when you're done, you're going to remember how good it felt to not do that, and you're going to find a lot more freedom in that joint capsule. Last but not least are what we call arm swings. And the way you're going to do this is on the floor, do it on a ball. If you can't do it on a ball, do it standing. You're going to lie on your stomach, and you're going to take your hands as high up as you can by squeezing your shoulder blades back, putting one hand on the back of your head, one hand on your lower back, and then switching back and forth like that, back and forth. Do that for 2 minutes. If you can't do it 2 minutes continuously, break it up into 2 1-minute parts. If you can't do it 1 minute, break it up into 4 30-second parts. That's going to help you mobilize your shoulders, work on your posture, and keep your shoulder blades moving better to help your shoulders. Thanks for watching. Like, share, subscribe. Tell your friends. Share it with people you know who suffer with shoulder issues.